Hello, so welcome to the tutorial. So we are going to do a tutorial of our hospital management system, that is a medical hospital management information system. So once you access the system, this is the page that you get, or the login page. So let's do a quick login here so that we see what you get. So once you log into the system, you land onto the dashboard, and this is what you get, the dashboard itself. So the dashboard gives you a quick overview of whatever is happening within the hospital. So the patients or the activities that you had within the day, the pending bills, there are some quick summaries over here. Yeah, and yeah, basically that's what you get. You can see what is there. So let's start working with the system. So the first thing that you need to do is once you get the system is to do the configuration or the settings that you need to use. So I'll come to this. So to do the settings or the hospital settings, you come to this section here. There's this drop down pointing downwards. You click on it and you come to the hospital profile. So from here, you can be able to set up a few things. So let me do this, and I want to use a real case here. So let me find the details so that we use those details to set up this. So one, just I'll launch my uh, one here so that I get the details of that. And what I need is this, and let's do this. So I'll copy this as the hospital name very fast. Do that. Um, that one, the uh, address here, it's here. I'll grab this, I'll bring that in. The phone number, I'll leave this one for now because I don't have it. The email, I have it, so I'll grab that. I'll throw that one in. And the patient ID prefix, you can just leave it the way it is. I'll do a quick save on those settings there. Then we'll come to branding here. On branding here, this is where I can do my logo. In case you want your reports to have signature, this is where you do them. In case you want your report to automatically be stamped, this is where you upload all those. So for this case, the logo is already uploaded, so I'll skip that part and I'll come to the billing option. The billing option here is where you do the billing that will appear on the invoice, the details that will appear on the invoice. So you can just put them here and all that. So in this case here, let me see. So we have the bank details here. You can do the bank details and all that. And this case, let's say I have M-Pesa details like this one. So I'll just copy these ones here. And these M-Pesa details is what are in here. So these are what will appear on the invoice for the M-Pesa. So, but for it, if I had the bank details, I just submit those ones here. The next thing is the billing here. So on the billing here, you can select the currency, as you can see, then the initial consultation fee. So when a patient comes to the hospital, the consultation fee is automatically assigned to the patient. So you can do that from here. So initial, then anytime they come again, the follow-up is usually almost the same. Then we have this markup here. So this markup is used to do some calculations on the service that you offer. Let's say you have drugs. You buy drugs at a certain price, then you do an increment on those price. So this is where you do the markup here, or you do the markup. So you have options here. You have the normal patient and you have the staff pricing here. So normal patients, let's say you want to charge working patients who are not staff of your hospital a certain percent on top of the medicine that they do. That's what you do here. You just give them, let's say it's 20%. So if the medicine was 200, it will be 200 plus 20% for normal patients. Then if it's the employees here, so you can see you have these categories here. So if it is the employee here, then again, same thing applies here. So if you want to give them a discount, or you want to charge them, so basically, if this is your staff, then you won't charge them as the normal, normal working patient. So for this one, you can go with something like a 10%. So basically, this is what I mean. when the calculation is being done on the drugs and everything, a 10% will be included and a 20% will be included. So that's the settings on the section here. So I'm happy with that. I'll leave that one. It is, and I'll do save those changes. So we are done with the setup of the hospital. So now let's start using the system. So I want to start by registering a new patient. We'll come to patients here, click on patient, and we'll just do. Now we have one patient here, but for this case, we'll just do new patient here. So I'll click on new patient so that we add a new patient. So see what we get. Sorry for that. So let's create a patient. So first name, I'll go with that. Forget the middle name, the phone number. I'll do a phone number here. 0597. Our gender, well, I'll do a date of birth here. Can say 0404. Like that. Then my national ID 123 456. Just something 789. Something that's yeah. Then their staff, this is what I was talking about. Now, if you select here, if you select employee, then they get that 30% discount. But now, if I leave it empty like this, it will use the markup for the normal patient. So I'll be charged 20% on top of whatever I'm supposed to be paying. Then we have any allergies that you have here. If I have any allergies, so I can say that I have allergy to cold, something like that. Any chronic disease, again, you can put those ones here, just separate them by commas as you go on. So once you're done with that, you click on create. If you want to add another patient, you just click on create and create another one. So these, which will save, these fields will be cleared for you to enter a new patient. But in this case, I don't have any other patients, so I just click on create. And that patient, you can see the patient is automatically created, and his or her profile is open. And this is the profile that I'm seeing for that particular patient, so you can see. So the first thing you need to do is once this patient is created, we need to send this patient to triage so that we move on to the next speed. So you can, if you're one person handling this system, you can just navigate to triage here and record the details. But in a hospital setup, reception will do the registration of the patient the way I've done, then the patient will be sent to triage. So if you click on triage here, go to triage, you should see the patient here. You can see the patient is here and the status is pending, and you can see I have this button to process triage. So I can do that. I can click on process triage and I can do whatever I want. Before you process the triage, then there are things that you need to record on the triage, like the temperature, the blood pressure, and all those. So in this system is very dynamic. You can input any details or measure or vitals that you want to capture in the triage. So you can do that by clicking on the vital settings here, or you can scroll down and you can click on the vital parameters here. So either works. So let me click on the vital settings here. So it will take me to this page here. You can see the page is selected, the vital parameters. You can see what we have. So we have the blood pressure, the heart rate, the temperature, all that, all that, all that. Those are the items that we have. So all these items are edited. You can edit them here and do whatever you want, or you can take the ones that you want. If you want to add a new parameter, again, you just click on new vital here, and you are able to uh, add the name, then the unit that is supposed to take. Then if they are charged, you just click on the price that you want to include. So remember these, if they are charged, then these charges will be included in the final invoice of the patient. Yeah, so just know that. But in this case, most hospitals, these ones are not charged, so you can just edit and leave these as zero. But for demonstration purposes, I needed to show that you can include the pricing there. So this is it. So let's navigate to charge, and we take the measurement for this particular patient. So the patient is here. So let's process this. So you click on the process charge here. Is what you get. So the nurse ID, if I'm logged in as a nurse, it will come here. But in this case, I'm logged in as the main administrator. So this field will be empty. But again, whatever I'm doing here, the nurse will be able to see the same thing. So charge level, So there are these options here. If the patient came in with a high, medium, or low, depending on the condition that they came in with, you can always book here. So say this is a low one, then not here. You can say that the patient said that they're having legs, legs, chest pains, and back pains. So just that as you do that, you take the parameters here. So blood pressure, let's say, well, I don't know these things, so I'll just be guessing these figures here. I don't know them. Heart rate, I don't know. Temperature, 37. This, I don't know these things. Oxygen, I go with 60. Weight here, 60. Height, 178. And BMI, yep. So just like that. Again, if you don't need this one, you can just click on it to remove it from taking or recording taking that measurement. So it is not a must that you fill in all these details. So once you are happy with that, you've taken all um, the measurements, you just click on save changes here. And once you click on that, you click on this complete triage. Then the system will ask you to select a doctor who you will assign the patient to. So depending on whose doctor is available at the moment, you just select. For this case, we have Dr. Sarah here. So I'll click on Dr. Sarah and I'll submit this patient. So this patient will be sent to Dr. Sarah. And you can see here now, the triage now is processed and they had low complications. These are these are the notes that were taken from that. Now, if you go to consultation or the doctor now on the consultation tab, they should be able to see the patient who is waiting to be attended. So you can see here. So these are the patients. So you can see the pending patients. So Dr. Sarah on her end should be able to see the patients who are on our list and she can be able to process. And you can see the patient here. So let's process this particular patient. So you just scroll all the way to the end and there is this button for view patient. So I'll click on view patient here. And this is the patient. You can see the details that we captured, the medical. So we said allergy cold. You can see uh, the overview of the patient. So these are the vitals that have been taken. These are the vitals. So the blood pressure and all that. So you might not understand this graph here, but if you click on the triage tab here, you can see whatever was taken or what was recorded from triage. Now from here, it is now your time to handle the patient. So what you do is you click on the consultation tab here. You can see right now the status is pending. So we need to see or we need to attend this patient. So you just click on edit here and we start the process. So this is the patient. So the consultation type, this is the initial or follow-up depending. So this patient is a first timer, so we'll go with initial. The patient name are the same, the doctor assigned, the status is pending. So don't worry about this. Once you finish this process, the status automatically changes from pending to whatever. So again, now as a doctor, you take notes here. Chief complaint, what is the patient complaining about? Again, dex, dex, uh, chest, chest pains, and back pains. Yeah, something like that. Then diagnosis, whatever as a doctor you feel is the issue here, you note that one down. And the clinical notes here. So you will know the clinical notes. You can say refer the patient to a lab test and maybe blah blah blah, whatever you want to do with that particular patient. Yeah, so that is it. And now as you do that, note that you've said that you are referring this patient to for a lab test. So at the moment the lab test is here, so you need to create a new lab test. So you can do this from here. You can come here, you just create a new order. So I click on that, then select the test that you need to do for this particular patient. So you can see all these tests that are here. So these, I'll show you where to edit these tests from. So just pick any. So I'll just pick something like that, and you can pick several of them. Let me see. Anything else I can pick. Blood count. So something like that. So you can select them like that. Then you can put on your note here for the lab technician. So something like a tech, sorry, sample. Yeah, you see. Then you click on miss. If you check now, what happens is you check now. If you go to consultation here, you can see a lab test has been ordered. But again, I think I forgot. Not I think I forgot one thing here. I didn't save my details here, so they disappeared. So remember those Dex, Dex chest pains, all that, yeah. So I didn't save those ones, so I was supposed to save these ones here so that they don't disappear when I order the test. So yeah, that is the patient. You can see now. Once you click and submit that, you can see now the patient, the lab order. Now you can see this tab for the column for lab order is one. So we've sent this patient to lab for test. So the next thing we now go is the lab technician now. So the lab technician on their end now, they should be able to, when they open on their end, they should be able to see what is pending or what they're supposed to do. You can see here now the patients that are pending. Okay, these are completed results, completed ones. Okay, yeah, the test is here. You can see these as the two tests from this particular patient. This is the patient that is supposed to have the test done. So let's see what we get. So this is the pending. Yeah, you can see what was ordered. You can see here the blood and the complete blood count. So as a lab tech, what you're supposed to do is once you do this particular test now here, so the price, you can see the price here. I'll show you where to set these ones from in a minute. But as a lab tech, once you do the test here and you have the results, you just click on record results here, and the results value here or whatever you get. Now I'm not good with this, so again, I'll go with something like 8 here. Then you do your note here as the lab tech, what you've seen. Maybe you can say increase in white blood cells, increase in white blood cells. Then the status now here is complete because you've done the test, and you click on submit. So that result is submitted. And again, once you do the blood count again, you just do record status here. Then whatever the parameter is here, so these are just holding values, so don't worry about them. What you're supposed to see is the white blood cells, red blood cells, and all that. So again, you just enter, and again, these, don't worry about the units. These are just templates holding that. So I can say something like that. Again, once you're done, you click on complete, and you can see these tests are completed. Again, as a lab tech, you can just add another test here in case the patient needs or request another test to be done that the doctor did not request. So you can just click here, and you can be able to add another test for that particular patient. Good. Now, where do you get these tests from? So that we see where you can edit these things like DKG. Those are not real things. So if you click on lab test here, you'll be able to see. So these are the lab tests that are supposed to do. Again, you can edit these, you can delete them, and so on. So nothing is fixed in the system here. In case I want to add a new test, I just click on the new tab, a new lab test here. And, I can give it a name. Code is automatically generated by the system. Then I can select the category of that particular test, so whether it is clinical, hematology, and all those. If something that is not on this list, I can click on the add here, and I can do the category name here. Yeah. Then I can do the unit, and I can do the pricing. Very important. Then these are the parameters that I was talking about. So if I was doing the blood count here, then here should be having the white blood cells, the units, and the range. Then I add another parameter, red blood cells, and all that. So that is how you do, or how you create new lab test. Then you can manage the categories from here. So you can add from here. You can also do it from here. So if I come to manage categories here, I should be able to see categories. You can see the categories that we have. So you have several options for managing it. So you can do a new lab category and you can add it here and it will appear on the other. Um, Perfect. So that is the patient for the lab tech. So after the results are done, if I go to consultations, if I go back to consultation as a doctor now, the patient is waiting. I should be able to see this patient here. I should be able to see the lab orders are done. Because if I move to the end now, you can see view lab order. So if I click on this, see what happens. It opens this and there results. I can see that it is completed. So I can call this patient in. And now if I call the patient in, I can see the results by opening the patient. So let's view the patient here. The patient. If I check on consultations now, you can see lab test one. If I click on it, let's see, should allow me to download the report so that I see what I'm supposed or what came from the lab tech so that I can be able to treat the patient. Okay. Okay, she's taking me back to the lab. I'll show you another way, but we have the print button here. If I click on print, I can preview this report. Let's see, so you don't have to download it. And you can see here the blood count. You can see what is there and the complete blood count. Yeah. So that is it. So that is the results that you see from the lab. So you can print it and all that. So let me go back to consultation. Go back to consultation. And I want to go back to this patient. View patient. I want to go back to the consultation tab here. I want to click on it again. Click on okay. Do I need to click on edit? Let me click on this print. It should give me the same thing. It should give me the same thing. Yeah, you can see. So this is a general report now covering everything that has been done. But again, it has a summary of the lab test here. You can see the lab test here. And for this one, based on the criteria or the levels that are supposed to be on the particular test, it tells you whether the patient is normal or not normal. So you can see these ones, the patient is normal depending on the ranges. This range here, 7 to 20, and again the same. Yeah, so this is the general report that the patient you can print for the patient at the end of the day. So that is the other way you can view the lab report. Okay, so now the patient is okay. You want to administer drugs for that particular patient so that they go to the lab and they get some medication. So for you to do that again, everything is done on this. So this is the particular visit that this patient has come for this particular day. So everything is done on this. So you click on edit here, click on edit, and give it a second to open up. So on edit here, you can see our lab result that was done. This is the other way again. You can view the results from here. So this is another way of viewing the lab orders. But in this case, we are done with the report, the lab, so we don't do that. So what we need to do is we come to actions here, and what I need to do is now we need to do another. So you can do another. You can send the radiology and anything that needs to happen. But in this case, we want to prescribe some medicine for this particular patient. We do that from here. You can admit this patient and so on. So I click on this, create prescription, but we've not talked about the inventory where the medicines are, so I'll come to that, but let's prescribe this first of all. Let's prescribe here, create. So this should allow us to, this is what you get here. So yes, so you can do some notes here again. Remember, this system allows you to, with each particular step as you move, you document everything. But in this case, I don't want to document anything here. I just want to prescribe these. Well, as a good doctor, you can do that, but okay, add medication here. So if you click here, it will bring you all the medication that are there. So you can just start typing here. Let's say I want mox. Yeah, you can see amoxicillin just pops up. So you can do that. You can type and you'll get all the medication. In this case, I'm not good with medication, so I'll pick anything that comes in my case here. So paracetamol, 500 mg. I'll select that. Then you can see here the dosage, 500 mg, frequency, uh, 3, 3. Then the duration on this person take this for 3 days. 3 days. Then the quantity that I need this person to get. Again, you know how they are, so I can do that particular one strip that they get. An instruction here, of tablet, 3 times 3. As simple as that. So you do the instruction and you click on submit here. So submit, yeah. So good. So we are okay. So click on submit. And you can see that one is added here. So in case you want to add another medication, again you just click on add here. Again, just repeat the same process. You select another medication here. Again, dosage. Okay, this is 400 mg. Frequency, this one I want you to take 1 times 1. Duration, 2 days. Quantity, go with so if you're taking, go with something like that. So 1 tablet at night, something like that, and you click on submit. So there you are. So you can see that one is done. So the medication is issued. If you scroll down to pharmacy, you can see the pharmacy part here. And you can see now we have a dispense. You're supposed to dispense drugs, and it is one because it's one particular patient who needs to get this medication. But before we dispense these, I talked about the inventory. So I'll click on manage pharmacy here. And here we can see the inventory of whatever we have in stock. So these are all the items that we have in stock. You can see these are the items. So in stock, they are all active, they are available. If it is low, you get this low item here, and you can add. You can just do new inventory here, and you can add the items. But I want to show you something else. This is baked in the pharmacy, but if you scroll down, you are able to see the inventory itself here. So you can come to inventory items and you can do the same thing. If you come to inventory, you should be able to see the same exact things that are there. So it's just two easy ways of managing the same thing. So let's see the inventory and see how it looks like. Then we see how we can add an item. Yeah, so you can see the inventory. So basically, you can see they are just the same particular things. Good. So let's see. So in case you want to do new inventory, so just click on new, want to add a new item, click on new item. Here we are. So the inventory code generated for you automatic. So the inventory item here, let's say you have ABZ, the department. So again, you have these departments here. So where is the medicine going to? So ABZ, simply this will go to the pharmacy. So I'll select on the pharmacy. Then category, what is it? So you have all these categories. So this is medication. Again, do that. So medication here, the description, sorry. So you can say that these are so basically whatever you're supposed to do. So these are for deworming. So just do deworming there. Then the current quantity, let's say we have something like 100 of them. Then the unit here, what do they come in? Pieces, boxes, and yeah, all those, you know what comes well. So I just stick with pieces, not good with that. So buying price here, I'll say that we bought these at around 30 bob, and we'll sell these at around 50. So again, something like that. So the order level. So by default, the system is set to 10. So when you hit 10, you'll get that low quantity notification. to tell you. Then the minimum stock that you should have, well, 0 if the stock is empty, so there is nothing. You can do that. Then the maximum stock, again, how much should you have? You can just leave that as empty. Storage location is not necessarily, but you can say something like a pharmacy and so on, or storage room 1 or whatever. So for easy tracking, you need to set these active because they are available. We have them, so we leave it at active. Then you can do the manufacturer. You can also select the supplier. So in this case, we don't have any supplier. You can click on the plus here. You can add the supplier who is giving you that medication. Again, under inventory, you can add your supplier from here. So then the batch number and the date of expiry, very important. In this case, I don't need all those. This is for demo. For you, you might need them. So in case you want to add another one, you just click on create, add. But in this case, because that one is enough. So I'll click on create. The, that item is created, as you can see from here. So if I go to my inventory here now, I should be able to see my ABZ. You can see my ABZ here, and it is in my stock. You can see that department pharmacy category is medication. So the same thing, if I go to manage pharmacy here, I should be able to see that item. So let's confirm that. You can see it is here. So those are various way you can manage your inventory. Yeah, good. So we are done with that. So let's go to dispense here, or we go to prescription, and we see what is there first of all. So this is a prescription. You can see this patient here. This patient, you can see items being prescribed for me. Those items are what are on the dispense here. So if I come to dispense here, go there, dispense, and here we are. So you can see these are the patient and the drugs, 2 items. So I click on dispense here. I should be able to see those. And so here we are, paracetamol. So you can see this is the price that I'll pay for the paracetamol. Then I proof, yeah, that's whatever. This is the price I'm supposed to pay for that because I took 3 of them. So 2 times 3, I get that. Yeah, you're getting it. So here we are. So you can approve one of them, or I can approve all. So in case one medication is not there, let's say this one. So don't click on approve. So this approval works when you have all these medication in stock. But if you don't work, if you don't have them, you just approve one by one, so that when the calculations are being done, the system will calculate whatever you've given, and whatever you've not been, whatever the patient has not been given, it will not be calculated, but it will be on the record that this patient was prescribed this medication, even if they didn't get it, so they bought it from somewhere else. So note that if you click on approval, all the medication, then you have them. That's why you are clicking on approval. But in case you approve one by one, it means that you don't have them. There is one that you are skipping. So in this case, we have all of these medication from the system of we've seen. So I'll click on approval. There we are. So they are approved, as you can see. So in case you make a mistake, you can remove by clicking on this remove button here. So this patient is almost done. So once you do that, you just click on complete and send to billing. It is. So this one disappears. So the dispense now is empty, and you can see the one has disappeared here. If you go to prescription, you can be able to see the status now. Let's click on prescription and see. You'll be able to see the status of that particular patient. Yeah, you can see patient here. It was dispensed. So the next thing is we were sent to billing. So I'll scroll down to billing, and we have invoices here. So I'll click on invoices. I should be able to, oh yeah, oh, you can see the patient here. So again, is pending here. So action here, have the action to view and print invoice. So whichever you want. So I can just view this one first of all, so that I tell the patient how much they're supposed to pay. But again, you have a quick view here. So it is, so that is the invoice. So that the patient, the total amount they're supposed to pay is this. And they're supposed to pay that because of the consultation fee. Remember, it was set up on the system 200. Then this is a triage, whatever was taken from the charge, and then the 2 medication that they got. So the total is this. So payment, nothing is done yet. Good. So you can print this, or you can from here. But I want to go back so that I show you the way. back. You have this option here, this button for pay. So you don't have to, because the amount is here. So you just click on pay. From here, you have several options. So that is the amount you're supposed to pay, payment method, whichever they choose. So I'll go with mobile money as an example. Then reference number that they used to pay. In here, uh, notes, not necessarily. The patient is done paying. Just click on submit. You can see the status changes to now. From here, if you print invoice now, so that will prompt me to download the invoice. So download that. Let's see. As that downloads again, I'll download, I'll action again, and print the receipt again. That will again prompt me to download it, so that so you choose the receipt. So this is the date you have paid for this particular receipt. So I select that and click on submit. So this receipt needs you to have the thermal printer, which is a small printer, so that you can be able to print that. But the invoice is downloaded and ready. See, so you can see the invoice here, the summary of whatever and the amount. So amount paid is that, the balance is 0. So again, you can print this, you do your signature and stamp here, and you give this to the patient. But again, I say there is the receipt downloading. So this is the receipt, but the receipt needs the thermal printer. So don't worry about the layout the way it is. This because it needs the thermal printer, the small printer. So uh, that is it. That is it. Yes. So that is it with the billing. Now, if we go back to the patient now, if we go back to uh, consultations, yeah, consultation. Now, basically, you don't have to go back to consultations, but let me show you something. I want to check the patient out so that the next time they come, we can open a new visit for them. So that is very, very, very important. So you can read from the doctor's view here, but I want to go to the patient here. I want to go to the patient. This from the reception part, or the payment. They are the reception once you finish out with the patient. So if you click on the view profile for this particular patient here, you have the option to end the visit. Now you have the option to end the visit. So because you can see the consultation is done, this consultation is done, everything is done here. The billing, you can see the billing summary is here, it's done and everything. This patient was not admitted, but in case you want to admit, you just click on this admit here. So these are not, it's just straightforward. You click on admit and the patient will be admitted. I'll skip that for now. I'll use another patient for the admission because I want to check this patient out. So I'll click on billing. I've confirmed that one is done and everything. Okay, let me see something else that I'm skipping here. Okay, checking. So we are good until that point. Nothing else is being for this particular patient. But in case this patient needs their report, again, you can just print this entire report for them here from here now. This report now will capture everything they had for that particular visit. Yeah, so we talked about this. But now we are done with this particular patient. Let's check out this patient. So you just click on check out from here. This patient now, the visit is closed. This particular visit is complete. You can see here the status, it's complete. Now when this patient comes to another visit, the next time they come in, you just click on check in, then you start a new consultation from this button here. So remember that. So when they come, you check them in and you click on new consultation. So we are done with that particular. So I want to go back to patients here. To go to patients here, and I want to pick another patient. So you can see this patient basically done. So you can check them in the next time they come. So you can do that from here. But I want this patient here that we do the admission part and you see how that works. I'll open this patient. I want to admit that. Right, so let's admit this patient. So I'll come to admission here and I'll click on admit patient. And just like that, this particular patient is admitted, and the next thing is they are waiting for the bed to be assigned. Now the nurse will be able to see this from their end, and the nurse can assign them the bed from here. But again, if you're one person handling all these things, you can just be able to do this from here. So you just click on this drop down here, because the setup is awaiting bed. If that the patient doesn't want, they change their mind and they don't want to be admitted, you can cancel. But let's assign this patient a bed. So you click on assign bed from here. You'll be able to select the bed from this particular list here. So you can say general ward bed 003, that, and you click on assign. So you can see that patient is admitted. The status has changed to admitted. They are on this particular bed 003. When it is discharge time, you just come and click on discharge from here. But that takes us to the next thing, which is ward. Let's scroll down. So lab, the laboratory, the radiology, and the surgery, they just work the same, almost the same thing. So for those ones, do not worry about them. We've talked about pharmacy. Let's go to wards now. So click on wards here. The first thing is you manage your wards. Now this is where you have the ward type, the bed capacity, and the pricing for that particular bed. So you can see the wards are created here. So you just click on new. Let's do that. Click on new ward. And basically, you just need to input the name of the ward and the number of beds in that particular ward. So let's confirm that. So you can see, just do the name of the ward, select type from here. So see the word type from here, and the price per day for uh, that particular word. So you do that. In case you have several, you just click on create and do, or create if it is just one. So I'll just cancel that, and I will go to the beds here. Okay. Before I go to the beds, let me go back to. If I go to the beds, I want to go back towards here. I'm skipping something. Let's see, I'm skipping something. Skipping the edit part of the words. So yeah, here are the words. So you can do the edit here. This is what I was skipping. You can click on edit here. You can change the name of the word. Yeah, you can change the name of the word, and you can change the price. So that's what I wanted to show you. So just in case the price has changed for that particular word type, so you can do that. The price per day is that. And we go to beds here. Now this one will show you the beds that are within each particular ward, if they are occupied or they are not occupied. So let's confirm and see if we get that. So you can see the total beds that we have is 48, available is 47. Remember, there is one occupied because we admitted one patient, and you can see the maintenance here. So there is no particular ward or bed that is under maintenance. In case you want to add a new bed before we go to this particular thing, you just click on new bed here. Then it will ask you to select the ward, the ward that you are, the ward type that you want to add the bed to, the price. Let's see. Yeah, so you can see select uh, the ward type from here, then bed number that you want to add, and the status if it is available, occupied, or maintenance. So that is how you add a new bed. We don't want to add any bed now. We don't want to add any bed, so we close that, and we check the wards, and we see the beds that are available and the ones that are occupied, so that we just confirm that the patient we admitted is in the ward indeed. Okay, yeah, so you can see the general ward, we had 20 beds, and right now there are 19 available because one is occupied, and this is the one that is occupied. You can see the patient here, the patient who occupied that bed, and that is Philip from here. All the other beds, you can see they are available, the private wing, the ICU, the maternity, the pediatric. So that is how you see them. So in case you want to discharge this patient, again, you can be able to do it from this section here. So you can just click on discharge, and the flow will start, and you can see discharge bed. Are you sure you want to discharge? Yes, so you just click on discharge, and this particular patient will be discharged. So click on cancel that. So that is how you manage that, manage your words. So let's scroll. We are done with the inventory, we are done with the invoice. Let's talk about the staff and the roles here. Now, this is where you manage your staff. So you can click on staff here, and it will show you all the staffs that you have within the hospital. So these are the staffs and the roles that they have. Now, roles allows you to filter out the rights that the users get to the system. So if it is a doctor, they're just supposed to see the lab, they're supposed to see the consultation, charge, and all that. So that is the role. So in case there is uh, a new user, just click on new user here, and you register that user. So you need to have the email, their phone number, the here their name, their email. When you create a password for them that they use to log in. Now they use the email and the password that you create. Then remember the roles that I talked about. You assign them the roles from here, whether they are admin. If you give them admin role, then they'll be able to see everything that you are seeing. If you give them the billing, they'll be able to view the invoice. Doctors, I talked about that. If you give them the HR, then they'll be able to see the staff. Lab technician, they'll be able to see the lab and the radiology technician, the nurse will be able to see triage, admission. The pharmacy will be able to see the pharmacy part and all that. So those are the roles that you're talking about. Then the title here, whether they're doctor, the nurse, and so on. When you select their department from here, then their phone number. Once you're happy with that, you click on create. If there are several, create and create another one. So yeah, that is it. And another important thing here is the shift. You can allocate your users shift, or your doctors and nurses the shifts that they need to do. So if you click on shift from here, if you come to shift here, you can be able to define the shifts that you do in your hospital. You have morning, afternoon, and all that. So you just set the time from that particular. If you come here, you can view, edit, and delete in particular a shift. If you want to add, you can add a new shift here. Now, once you set up the shift here now, the important part now comes here where you do the shift schedule. Now, each user who is logged in, they'll be able to see this schedule on their dashboard. So they'll be able to know which particular day they're supposed to be in and which particular day they're supposed to have their off and so on. So you can see the shift loader here, how it looks like. So let's say Dr. James, the surgery guy, I want this surgery guy to come in on Wednesday. So I just click here on Wednesday, add shift, then I pick the shift that I need this guy. So I need this guy to come in the morning shift. So I'll click on that, the morning shift. There it is for Dr. James. Again, I want this guy to come in on Friday, but on Friday, I want this guy to come on a night shift because we have surgery that we need to do. The shift. So this one should pop up the night shift on this particular. Which day was it? Friday. So it might take a second or so to do that, but it will pop up, so don't worry about that. You can do a refresh to confirm that. But as you wait for that, yeah, there it is. As you wait for that, you can say that these are lab tech. I want Emily to be here during the afternoon shift so that they change. So I'll click on that. The this one for the lab tech again will appear. So when these particular users log in on their dashboard, they'll be able, when they come to the shift schedule here, they'll be able to see that I'm supposed to come on the afternoon shift on this particular day, on this particular. So you sort out your doctors and your staff so that they know which particular day they are supposed to come in. Yeah, so that is it. That is a walkthrough of the system, but the system won't be complete without reports. So reports, if you come at the top here, you have the analytics and reports. So click on this here. From this tab now, you should get a summary of whatever is happening within your hospital. Also, you can be able to generate reports and print those reports and see what is happening within your institution. So let's give it a second. So this is it. You can see this is the total revenue that we made on this particular day. So you have these shifts or these filters at the top here. So by default, it will always be on all time. You can see the patients that we had. So yeah, we had two patients. You can see items that are on stock and bed occupancy 4% because only one patient. Then the revenue trend. Now this you won't see anything because it needs the month to be complete so that you'll be able to see that. Then you have the patient status here. Admitted, we have two patients, outpatient, one patient, emergency. We didn't have any emergency, but there is one stored in the database. We didn't capture that. Discharge at the moment, none. Then down here now we have the reports themselves. I didn't talk about appointments. So, but we have appointments. If you scroll down, we have appointments here and we have visits. So visits, these are the patients who have walked into the hospital on that particular day. And the appointments is the patients who made appointments to see a particular doctor. So once they do that, you can generate the reports from here. So if you come to appointments now, if I download this report, it should be empty because I don't have any particular. So let's just download that. As that downloads, let's do the bed occupancy. Download that. So I won't download all the reports. I'm just showing you a sample. Then I'll download another report here, which is the billing. So download this. And, the other report that I'll do is the shift schedule. Yeah, in case you want to see, it's for the HR. In case you want to see who is on duty, shift. I'll download that and override that. Remember downloading. The last I want to do is the inventory. Yeah. So I'm just downloading sample reports so that you see how they look like. Override that. So the report that I should download, inventory stuff. Mm, mm, mm. Is it? Yeah. Patient summary. Yeah. So you have those reports that you can download, but let's work with the ones that I've just downloaded. So these are the reports that I'll open. Them. Open these reports so that we view them one by one. Yeah, so you can see this is the shift schedule that you can see who is on shift. You can see here, so you will know who is on that particular day. That is the shift. Then you have the billing, so you can see billing that you have here. So you can see this guy here is the one who was just treated. You can see the amount that I was charged and it is paid. All the others are pending and all that. Then you have summary here, the total, the pending, and the paid. Yeah, so we have that. That is that. The other one that we have is this one here. This is the bed occupancy here. You can see beds, all of them, ones that are not occupied. You can see. Yeah, so we have 48. One is occupied, so 47 available. So there was another patient who was admitted. So yeah, that is how you see those particular reports here. You can see the one that is occupied 003 here is occupied by Philip who we admitted. Yeah. Okay. So the other one is we talked about that receipt, we talked about that invoice, the staff. You can see the staff here. You can see where they are and whatever the role that they have and their status, whether they're active or inactive. So that is the total. Then we have the inventory report here. You can see everything that you have stock and everything. And the good thing is it gives you the total amount of the inventory that you have on in your hospital. So I think that is that. Did I miss anything? The appointment, as I said, is empty. We've talked about the bed occupancy. Yeah. So those are all the reports from the system. And basically, that is the entire flow of the system and how the system works. So thank you, and I hope you enjoy using the system. If you're interested, talk to us, and we can have this system shipped and ready for you to use. So the dashboard, you can see the summary here. Yeah. So that's it from our end, and enjoy the system. Bye bye.